When you start working with surface electromyography, it's easy to feel overwhelmed by the data and graphs. But if I had to start over from scratch, there are 5 key neuromuscular concepts I would prioritize to truly understand how to apply this technology to clinical practice. These principles will not only allow you to interpret muscle activity more objectively and accurately, but they will also help you make better treatment decisions. To make it easier for you to integrate, it is detailed with real cases in this post. By the way, if you want to get all the complete information about mDurance without purchase options, access all the information through the link in the description. In this post, you will learn 5 key neuromuscular concepts that will help you better understand your patient's pathologies and how to resolve them with greater confidence. The first is excess tone. One of the dysfunction parameters you can detect with electromyography is an excess of muscle activation at rest. That is, when the muscle should be relaxed. Let's look at a real case. A patient presents a basal activity in the lower trapezius muscles 12 times higher than normal. This excess tone may be related to a protective mechanism due to her pain or as a compensatory mechanism caused by her posture. And if not treated, it can limit mobility and cause persistent discomfort. These types of findings completely change the way you approach your patients. Second, muscle compensation. Another common phenomenon in pathologies is muscle compensation, where one muscle works more than it should to make up for the deficit of another during a movement. Let's look at a real case. A patient activates the left upper trapezius twice as much as the right one to perform a shoulder abduction movement. The problem is not only that she uses one side more than the other, but that she does so to achieve a worse mechanical outcome. Identifying compensations allows you to redirect muscle work towards the correct muscle, preventing incorrect patterns from becoming established over time. The third is an activation deficit. Muscle activation deficit is perhaps one of the most expected findings when using electromyography and also one of the most revealing. It occurs when a muscle works less than it should during a movement. Again, let's look at the previous real case. In the same previous case, we observed that the patient activates the left deltoid half as much as the right in the injured shoulder. This difference is not visible to the naked eye, but it clearly explains the lack of mobility and the lack of stability and the compensations observed in the upper trapezius. When you detect these deficits, you can customize exercises to restore specific muscle function and measure improvement objectively. The fourth is the delay in muscle response. Not all muscles function poorly because they are activated too little or too much. Sometimes the problem is that they respond late. Look, in this case, in this patient, we see that his left peroneus brevis takes almost twice as long as the right to reach the peak of maximum contraction. Although the final strength is similar, the response is slower, which can affect stability and motor control during walking or sports practice. This type of alteration often goes unnoticed without electromyography and is crucial in patients with instability, recurrent sprains, or difficulty reacting quickly to external imbalance. The fifth is muscle symmetry. Muscle symmetry is a very valuable indicator when we analyze bilateral movements. Under normal conditions, we expect relatively balanced activation between the left side and the right side, unless there is a dysfunction. Again, let's go with a real case. During a squat, the medial vastus of a patient shows only 53% symmetry. This difference may be due to pain, a previous surgery, or motor control deficits, and it must be addressed to prevent it from developing into more serious functional imbalance injuries. Electromyography helps you quantify that asymmetry and track its evolution more precisely. Therefore, before applying any of these concepts in your practice, you need to ask yourself 3 key questions. How many of my patients might have some of these motor alterations? At what point in the evaluation process? Can I introduce this analysis with electromyography? Will my patients feel more confident if I show them this objective information? Learning to read these patterns with the help of electromyography will help you go beyond visual observation, personalize treatments, and achieve faster and more lasting results. See you in the next post.